Good morning, everyone. There are still people joining. But yeah, let's get started because we have a very packed and interesting agenda today. So welcome to the second webinar of the series on data spaces organized by the Data Europa Academy. So this webinar is, as you can see in the title, Experiences from Strategic Data Spaces. We will have experts from sectorial data space that are being developed, the health data space and the cultural heritage data space, and we will hear more from them about what's the scope of what they're doing, what are the benefits, challenges, and also what's the state of play. So as you know, all these webinars are organized under the Data Europa Academy, that is your learning hub for open data. So before we get started, some rules of the game that we always remember. So this webinar will be recorded. So please do not hesitate to go back and watch it on the Data Europa Academy, that because there will be a special course. There's already a special course on data spaces where you can have all this content together. For questions, please use the Click Meeting chat, this tool that we're using today, because they will be addressed at the end of the presentations. And your feedback is very important for us to to improve in the future and to see how 2024 is going to look like in terms of trainings and webinars. So please reserve 3 minutes after the webinar to help us improve and fill up our feedback form. But well, so I mentioned that in this webinar on data spaces, we will count with experts from sectorial data spaces. More precisely, I have here with me Jerome and Caterina. Welcome both, and thank you so much for being today with us. So Jerome de Barros, is a policy maker working at the European Commission in DigiSante, with more than 10 years of experience on digital health programs and policies, but he also has been working before in the Commission as a data-driven innovation lead on healthcare at the University of Edinburgh. So he will present to us the health data space. And then we also have here in the room Caterina Motojani, who is policy officer working at the European Commission in the Director General of DigiConnect. And she will present to us the cultural heritage data space. So this is how the agenda is going to look like. So I will have like a first introduction myself, as I will be moderating the session. Then we will give the floor to Jerome de Barros, who will present the health data space, followed by Caterina's presentation. And then, as I mentioned before, we will have a lot of floor for questions and answers. So don't hesitate to place it in the chat, and we will make sure that they're addressed by the speakers by the end of the session. But then some refresher about the concept of data spaces and what we have been doing on the Data Europa Academy. As I was mentioning before, this is the second of the series of the webinar on data spaces. We already had one on introducing the concept and relevance in today's society, where we had also the European Commission, DigiConnect, to present the understanding, what's the legal framework, why these data spaces are important. Basically, from the European Data Strategy in 2020, it was invited to invest in common European data spaces to speed up the development of the European economy and also to harvest the value of data. So the creation of EU common interoperable data spaces in strategic sectors such as cultural heritage of health was aiming to also overcome legal and technical barriers of data sharing and also provide the necessary tools to ensure interoperability and allowing infrastructures to facilitate data pooling and data sharing. So we can say that they are secure and privacy preserving IT infrastructures built up for this purpose of data sharing and data pooling. But at the same time, there's like some data and governance mechanism agreed by the stakeholders participating in the data space on how to share the data, like legal aspects, licensing, so on and so forth. So with this, data holders are in full control of their data and they decide what data is going to be shared and under which conditions in this case. So we ensure that this secure, but at the same time, we facilitate data sharing. So with this data sharing infrastructure, we also boost the data presence in the with these infrastructures, because there's like a presence of vast amounts of data. And also the interesting fact about data space that is not only focused on the public sector, but we also have other type of organizations, individuals, private sector involved in this initiative. So this is how the different common European data spaces look like. So they are being developed in various sectors to respond to this European strategy for data. They have together some horizontal aspects, some synergies and aspects in common in terms of interoperability, infrastructures, but at the same time, there are like conceptual differences, different purposes why they were developed. So as you can see, today we will have two specific data spaces, and we will envisage in the future how we can have more data spaces on board on the Data Europa Academy to give insights about what they're doing. But now it's time for our first speaker to intervene, Jerome de Barros, for the health data space. So Jerome, the floor is yours.
Thank you, Inma, and good morning, everyone. So what I will do today is to give you a brief overview of the European Health Data Space, so the data space covering health data, and go into more detail on two of the key parts of our initiatives on the primary use and secondary use and the infrastructures that are underpinning those two uses. And finally, I would just present a brief timeline of different actions that we have ongoing to make the HDS a reality. So starting with this overview, first, I would bring in some context. So why did we decide to bring in the European data space? So first of all, it's obviously part of the European strategy for data that was announced by the Commission back in 2020. One of the sectors identified being health. This led to us going forward. The broader context also, I would say, helped, or at least made it possible. So first, obviously, the COVID-19 pandemics really highlighted the importance of sharing data, of having the right tools that we needed to be able to look after people, but also to understand what was happening. So this really created a momentum that we tried to build on to propose the European data space. And the first step was to understand what are the challenges that need to be addressed. And these are the ones that we had identified then when we're preparing the proposal for a regulation. First of all, being that all of us as individuals have difficulty accessing our health data, not only accessing it, but also controlling it. Um, and the same happens with healthcare professionals. Sometimes it is very difficult for them to be able to have access to the right information at the right time when they are seeing a patient. We also identified difficulties for providers of health service and solutions to be able to introduce their products, making sure that they are integrated to the clinical pathways, but also simply procured. So this is something that we also aim to address. Finally, when it comes to the reuse of this health data, we identified two main communities that share the same difficulty to access the data for policymaking when it comes to public and private policymaker organizations, but importantly as well, our researchers. There really is a lack of innovation and research taking place when using this health data due to this difficulty in accessing it. So so what was proposed is this regulation on the European Health Data Space. Breaking it down, so what it is a set of rules after this legislation, but also of common standards, infrastructures, a governance framework for the use of health data for healthcare, research, innovation, policy making, but also regulatory purposes. So use of data for care, but also for what we identify as secondary uses. And it has these three objectives that you see here. First is empowering individuals to access, but importantly to control their health data, being able to have access to it, but also deciding on who should have access to this data, being able to share it when they want it. The second objective is to unleash the data economy by fostering this genuine single market. So providing a set of uh, rules or specifications for, in particular, electronic health recording systems, so that these systems are interoperable but can be also rolled out across Europe following the same rules. And finally, when it comes to research and all those secondaries that I mentioned, it was proposing a consistent framework for the use of health data for those purposes. So the EHDS is the first sector-specific European data space, and we will hear just after me about the one on culture. But we are foreseeing data spaces across a series of sectors from finance, agriculture, industry, skills. So the idea is really to make sure that each of the different sectors has a personal data space that really drives the use of health data, and that is underpinned, as you can see in the box below in blue, by a common technical infrastructure, so that all of those different data spaces, regardless of their specificities, such as health, for example, are able to interoperate, and making it possible for users to have access to data across those different sectors, different data spaces. Perhaps what differentiates the European data space from others was the need to first set a legal framework for the use of the data. The data space only makes sense if data can flow. So what we did was to, as I mentioned, propose these regulations, and importantly, it is creating strong links with all other legal proposal initiatives in the area, starting with GDP, obviously. We'll build on top of the GDPR and propose specific provisions for sensitive health data. Um, we are contributing to the European Health Union. Think about the European EU Cancer Plan, what is done by HERA when it comes to prevention of and addressing health threats, and contributing to the pharma strategy, for example. We complement the Data Governance Act and the Data Act by providing tailor-made rules for the health sector. We are fully aligned and complement the EU cybersecurity framework, so the NIS directive. We support other relevant initiatives such as the AI Act, obviously, and the medical device regulation, so by providing specific provisions for, on the one hand, EHR systems, but also on the use of AI for health specific or supporting it. And this is the legal base really for what is proposed under the HDS. So as mentioned, building on Article 16 of GDPR, as well on Article 114, that is to aim to improve the function of the internal market. So this is how we build on to be able to propose this easiness to enable the interoperability of EHR systems. Very importantly, it is in full respect of Article 168 of the TFEU, that is, EHDS by no means intervenes in how care is organized or delivered in the member states. And what's also important to point out is that both personal health data but also non-personal data are in scope of the legislation. And so the main objective of the EHDS is this effectiveness of health data, both for care and for those secondary uses. And I go back to this dichotomy here: primary use, secondary use. So use of health data for care, primary use, and the use of health data, secondary use. When it comes to the first one, uh, some of the key provisions that we are proposing is this empowerment of individuals to control their data. What we mean by that is that they will not only have access to this data themselves, they will be able to share this data with healthcare professionals, organizations that they wish to. They will be able to edit this data, correct entries that are, or propose at least corrections for entries that are no longer up to date or incorrect or missing, um, able to withdraw access or hide access to part all of their data if this is their wish. So this is what we mean when we talk about this empowerment of individuals to control their data. We're also proposing standardizations and mandatory certification of EHR systems, the voluntary labeling of wellness apps, and promoting the use of a common format for this data, the European Electronic Health Record Exchange format. And this is what we believe will lead to this single market for health data and digital services and goods. When it comes to the reuse of health data, so the secondary use, some of the key provisions are first setting up what we identify as health data access bodies. So these are national agencies, national bodies that will be facilitating this access to data. So taking decisions on whether or not this access will be provided. We are defining a series of purposes for which these data can be made available, as well as defining some purposes for which this use will be forbidden. Think of anything that will be detrimental to to individuals. We're proposing a specific pathway for how this data will be made available. So those will be underpinned by data permits. View this almost as a contract that define what data would be made available to whom, under which conditions, and for which duration. Importantly, all the data that will be made available on the VHDS will be either in an anonymized format or pseudonymized, and always in a secure processing environment. So we want to ensure there'll be no re-identifications and the data is always safe. The data is accessed in these secure processing environments, cannot be downloaded, can only be data can be analyzed and processed there within this secure space. And this is what we believe this will lead to this facilitated research innovations and better policy making. This is what we're proposing on the legal side, and I will touch on the other parts specifically around the infrastructures and the capacity building. So making sure our member states are ready when EHDS comes into place. When it comes to primary use, uh, one of the key initiatives that is already ongoing is the My Health at EU infrastructure. So this is an existing infrastructure that connects healthcare providers in already 11 member states, and it allows the cross-border exchange of health data, most specifically, at the moment at least, patient summaries. So view this as a summary, very brief description of a patient, identifiers, conditions, any kind of allergies, medication, and e-prescriptions, enabling the possibility to use these prescriptions in more than one country. We intend to extend the services with lab results, medical images, and report on those images, and medical discharges. So the idea is to, with time, increase the type of services and type of data that is shared through My Health ITU. But more than that, we are also, through these legislations, moving from this voluntary status to making it mandatory for member states to be part of My Health ITU. So the idea is to move from 11 countries to 27 countries. We are also, we already started the projects for the piloting patient access, so ensuring that all of us have access to the health data that I mentioned before, the one that is standardized to the electronic health record exchange format. And from 25 and 26 on, the idea is, as I mentioned, to extend the type of services that would be available. So when it comes to secondary use, the legal proposal defines what data will be within the scope of these legislations. And this is a wide encompassing set of data for obviously electronic health records, clinical, so most clinical data, but also research data, genomic data. So the idea was to really, as much as possible, include the type of data that are relevant for our researchers, our regulators, and our policymakers. Um, Defining those purposes for which this data could be made available, policymaking, regulatory, research, innovations, development of new products, including AI algorithms. Defining those prohibit purposes that I mentioned before, and defining how will those have the access bodies I mentioned before will be set up, what will be their obligations and their tasks, but also what will be the duties of data holders for the European data space to exist. One of the key parts is to make sure that existing data is known. So data holders will need to fill in a dataset description so that this data can be known and make this data available if a permit is granted, that is, if the health data access body authorize accesses to user. And this will be facilitated by the health data DU infrastructure. So these infrastructures will connect those health data access bodies that I mentioned, also will connect those health data access bodies with relevant counterparts. For example, European agencies such as the EMA, so the European Medicine Agency, and the CDC, so the Public Health Agency. Existing data sharing infrastructures. We have European data sharing infrastructures existing. So the idea is also to enable the connection of such infrastructures with other relevant actors. And we are also foreseeing the Health Data EU to connect with third countries, countries that would comply with the requirements that we set in this legislation. Importantly, we are also developing central services that would enable this communication between the different actors. So this will be provided by the European Commission, what you see there in the middle. And in a sense, this is what the path that we are trying to enable. So making it possible for a researcher or any other user to first discover what data could be relevant for research or the use intended, being able to then apply for this data, being able to use this data for a permit application that can reach then the health data access body, who, should this access be authorized, would contact health data holders so that this data can be prepared and then made available to data users. So these data provisions in this secure processing environment. This will then enable these data users to analyze and process this data. Very importantly, at a later stage, also publish those results and ensuring that we have this, the process is obviously ensured throughout the process, but also enabling the verifiability of results that are published. So the idea is really to make sure that when access is provided, the process is transparent, is secure, and research results from this analysis can benefit the wider community. When it comes to the implementation of EHDS, so this is the timeline that we have ongoing, starting with the legislative process. As I mentioned, so the legal proposal was presented by European Commission in May 2022. Since then, it's been in under negotiations with the European Parliament and European Council. We expect these negotiations to go on until middle of next year, where we hope to, or the objective at least of all the parties involved is to have an agreed text by the middle of next year, so we could have entry into force and the framework to apply within a year from now, so from mid 2025. We couldn't wait for the legislations to be agreed upon. So we already started work on its implementation, starting with the inception phase. We have what's identified here as the TEDAS project. That was a project together with the member states to define what should be covered under these legislations, and try to shape the different provisions that were included in the proposal. Since October 2022, we also launched a pilot project for the infrastructure that I presented just before, the infrastructure for the secondaries of health data. So we have the Health Data at EU pilot that is led by the Health Data Hub, so the French data agency, and involving 17 partners from 9 countries to develop a pilot of what would this infrastructure be and develop 5 use cases to ensure that what will be developed really answers the needs of the different users and that we have almost a beta version of this infrastructure that could then be scaled at a later stage. In parallel to that, we are also already supporting implementations in the member states. So we uh, launched a call for grants to member states to help them set up FDT access bodies by either setting up new bodies or reinforcing the role of existing agencies so that HDAP can be in place when the legislation comes into force. We also will have, starting in the beginning of 2024, a project focused on capacity building. So really here ensuring that the right capacities are available in member states when the legislation comes into force. Data quality is a key part of the European data space. So we will have a specific project, Horizon Europe projects, focused on data quality and utility. The idea here is to define what um, data elements should be provided besides the basic descriptions that I mentioned here before, so that a user understands the usability of a specific data set for the use intended and about the data set itself, how was it created, curated, and how relevant therefore could it be for the use intended. Finally, we'll have a project that will help us with the implementing act. So these will be the elements of the legal proposal that needs further refinement. For example, we mentioned that data needs to be processed in secure processing environments. What these projects will help us is to define what should be the technical specifications of those secure processing environments so that they can comply with the EHS regulations and can be used as part of the process. And this will also be the case for other elements of the proposals that need further refinement. EHDS is not a project, it is a permanent infrastructure. So throughout time, we foresee this infrastructure to evolve so that it continues to meet the needs of users. So we'll have this continuous operation phase for it to be running, but also for it to evolve to answer those needs. So this is in a nutshell what we intend to do in the coming years to make the open database a reality. And I will stop now and pass the floor to my colleague Katarina, who will tell you more about the cultural heritage data space.
So, hello, good morning from me as well. I will talk about the data space for cultural heritage, which has, they is dealing with a different type of data, cultural heritage data, and it also involves cultural heritage content. Before talking about the data space itself, I will talk a little bit about the policy framework. So, following the adoption of the data strategy, the Commission adopted a recommendation in November 2021, so almost 2 years ago, announcing the Common European Data Space for Cultural Heritage. The overall objectives of this recommendation is to pave the way for making cultural heritage data widely accessible to individuals, but also to businesses, other sectors, and making this data available for use and reuse. And at the same time, to help member states accelerate digitization and preservation efforts and to seize the opportunities of digital transformation, because both are important and necessary to make the data space possible. Digitization and online accessibility of cultural heritage has been in the policies of the Commissions for many years, since already as back as 2006. So this recommendation is revising a previous recommendation in this area. The main elements were to broaden the scope, and the main idea is that the recommendation, which is addressed to the member states, invites member states to set up comprehensive digital strategies and take up advanced technologies such as 3D or artificial intelligence, data technologies, and so on, and encourage them to contribute to the data space for cultural heritage and to Europeana, which I will talk a bit more about, with high quality data and giving emphasis to 3D content as well, focusing on interoperability, uptake of standards and frameworks to make that possible. There are other elements in that recommendation aiming to help the digital transformation and the advancements in the digitization, such as upskilling and reskilling professionals, promoting cross-border collaboration involving SMEs, and encouraging member states to use funding possibilities, various funding possibilities at EU and national level to that end. So in this context, and with this as our main policy framework, the Commission is funding the deployment of the data space under the Digital Europe program, which is the program that is funding the full set of data spaces. And the specific data space is not starting from scratch. So it builds on the work and experience of the Europeana digital infrastructure and the work and investment since 2008 over other funding programs to enable making cultural heritage available to the public, to professionals, to various stakeholders. So there is continuation, but there is also change, because there is a lot of work that needs to be done to adapt this data space to the new context of the data spaces, the data spaces framework. So we're having a service contract at the moment with a consortium of 19 partners, and the Europeana initiative is at the heart of this consortium. The consortium is led by Europeana Foundation, who were also in charge of the Europeana digital platform for cultural heritage, which I mentioned has been there since 2008. So there are four main work areas to take the data space for cultural heritage forward. So we have, of course, the infrastructure. So as part of the work, the consortium is working on evolving the infrastructure and the services to support the growth of the underlying data repository. So as the systems that are already in place need to be adapted to support new types of data, for example, higher quality data, 3D data, which is the new element. And at the same time, the consortium is looking at improving the identifiers that have been used for the records, working towards persistent identifiers. And also, it is exploring various approaches for decentralized aggregation because, as I will explain in a bit, the model up to now has been focused on a centralized way. I will talk about this in a bit. And then, of course, there's collaboration with the Data Spaces Support Center, which is the coordination body to ensure interoperability and common approaches with other data spaces. Then we have also existing application programming interfaces that also need to be expanded and advanced to allow this data to be accessible to more services, to more people in different ways. So in terms of the aggregation organization, let's say, the concept is that the Data Space for Cultural Heritage works with 40 accredited partners. The aim is to have one national aggregator in each member state, but there are also domain aggregators who look and help institutions with the specificities in their domain, such as audiovisual or archives, for example. Cultural heritage, the accredited aggregators help cultural heritage institutions prepare their data and submit them in the right way to be ingested in the main infrastructure of the data space. So the other aspect, data governance, the idea is to develop, and already work has progressed on developing a data governance strategy together with the stakeholder community. So the idea is to ensure that data is can be used, shared and used, also through new means and new purposes, exploring also different possibilities for the community to ensure that their data is used and shared in their interest. So there are already data governance is building again on existing frameworks and standards, which are now evolving to support those the new types of data, such as 3D content or metadata enrichments, but also other types of data that will be developed as part of the data governance strategy. There's also work on raising data quality because there's a lot of legacy data from years back, and resolving issues that come with data that is not alive anymore, broken links, and other issues. And an important element is also providing feedback to data providers and to other stakeholders about what exists there. And this is through a data statistics dashboard, which gives an overview of the data that's already in there. And then there's work now to expand this to give feedback on specific elements of the data for each provider. I want to talk a little bit about those three frameworks that I talked about. The Europeana data model is a harvesting model. So the idea is that the metadata that the different cultural heritage institutions are using for describing their records in the different formats can be mapped and migrated to this common model, the Europeana data model. Then the licensing framework so far provides a set of rights statements, a set of 14 standardized rights statements, which indicate the rights of the digital content and indicate the extent to which the digital content can be used. So the metadata that describes that content, however, is meant to be openly available without a copyright limitation and can be reusable. There is an effort, so the other element is the Europeana Publishing Framework, and it provides a set of tiers, what is called as quality tiers, for the content and for the metadata. And to move up the content tiers, so the highest content tier means the content that is of very high quality, but also openly available. Then the metadata, the highest metadata tier means metadata that are also using vocabularies, enabling, facilitating search and retrieval in various ways. There is, as I said, there is an ongoing effort to increase the quality, and this is like an overview of what we have now in the data space. So 55% is what we call tier 3 content, which means it's high quality and reusable in a certain way, although perhaps under certain conditions. 73% is high quality content, although it could be, the reuse could be restricted. And then we have 74% high quality metadata, reaching the highest metadata tier. We still think it's important to have the content there, even if it's in the lower tier. However, we're making efforts and to encourage institutions to upgrade and try to see whether their content can be made available in better quality, possibly in a more open format, in a more open way. So then, how is this data accessible at the moment? So there's the well-established Europeana.eu website, which provides several ways of accessing the data. We have multilingual access in all 24 official EU languages. It provides advanced search and filtering functionality, and there is more and more work on improving those. There's also the feature of user galleries. So individuals or cultural heritage institutions, for example, can compile their own set of content or other data, editorial content, and create a user gallery that they can also share with others. Of course, there's also user engagement via other channels, social media channels, and work with partners to further promote this work in their contexts. And I'll just show you very quickly the Europeana.eu website. If you haven't visited it, I encourage you to have a look. There are more than 50 million records at the moment, and 7,000 user-created galleries. And it also provides, as I said, ways to navigate in the content, variety of content, mostly images and text, but also there is rich content, audiovisual content, and some 3D objects, which we are trying now to work on expanding and encouraging member states to embark on 3D digitization and sharing the 3D models also in the data space. Finally, the community part and the capacity building part. So there are over 4,000 professionals, digital and cultural heritage professionals that are part of the network. What is not in the slides also is that the data that is provided comes from over 3,540 cultural heritage institutions across Europe. And then, as part of the capacity building efforts and the efforts to foster reuse, the consortium is offering a program of training and events, and there's also a knowledge base, which I will provide the link later. And there's also peer-to-peer knowledge exchanges for cultural heritage professionals who are interested in sharing data, but also using the data that's there. Then there's work with education communities, teachers. There's a very big network of teachers that are currently using the content from Europeana.eu in their classroom. And there's a lot of support provided for that. And there's we see a lot of potential there for ongoing work. There's also work with the research community. There are some there are various activities organized there promoting reuse in academia and research, and also there is a lot of work with API users and developers, so technical partners, trying to who can also use the data from the data space. So the focus now is on improving and tailoring the API documentation and training to enable and facilitate interested users in that sense. And last but not least, there is also ongoing work on expanding the sectors that can potentially reuse content from the data space. So we're looking now at the media, tourism, creative industry sectors. So in the coming year, there will be more work on approaching other sectors and other communities. Another interesting website which I would encourage you to visit is Europeana Pro, which is in the address pro.europeana.eu, and that's where all the information, support, and guidance for the community is provided. There are news about what is how the work is progressing. There's also links for those who are interested to share data, those who are interested to reuse data. There are supporting tools. So it's the hub, let's say, for the community. And finally, in addition to the service contract, under DEP, the Commission is funding what we call supporting projects. So there was one call for proposals, one call for grants last year, and that has led to 4 projects which will contribute with either 3D data or advanced technologies such as AI, and they will also, all those projects will improving the capacity of the cultural heritage institutions, and helping them in their digital transformation. And there's one more call for grants, which in this direction, focusing on 3D and extended reality content, and how the data space can in the future expand to support that kind of content as well. And this call was published yesterday, and yeah, the submissions I think will start. It will be open for submission later this month as well. So thank you very much. And I would also like to invite you to follow the unit's Twitter account, digicult.eu, where you can find also the news and the latest, latest developments in this area. And you can also, I think, follow the Europeana social media, which will give you the information about the consortium work as well. So thank you very much.
Yes, thank you very much, Katerina, and also Jerome for these great interventions. We could see here in practice how like that with the objectives are different, but the goal is about data sharing between different communities to bring added value to our economy and our society. So thank you very much. Also because it was very easy to see like the different aspects between both, and also what are the synergies between them. We have many questions, as you may have seen. I try to cluster them as much as possible. So now we can slowly go into the questions and answers. The good thing is that we have like around half an hour for this. We had different type of questions, also comments, some even knowledge sharing between the different users, which is great to see that there's like so many discussions going on. Some questions are more general, so I can directly address them. Like, for example, there was one question on maturity models, explaining data providers how to deliver data and have a good data ecosystem. Fortunately, and this is a bit outside of the data space discussion, but then we will deep dive into that. On data.europa.eu, we have the open data maturity assessments. So we undertake an exercise with 35 member states to measure how they are dealing with open data in terms of policy, impact, quality, and portal. So I would suggest you to go to this report, because it's a yearly report where we gain insights about how they are developing, and also we deliver some recommendations. These are outside of the data spaces scope. Then there was another question regarding the concept of data spaces and the concise definition about that. We share with you in the chat the staff working document, and also the previous webinar that took place, where you can have a look at the clear definition of data spaces, and done by DigiConnect, the European Commission. And then for recommendations, the European Commission recommendations on sectorial data spaces such as industrial and manufacturing, as you may be aware, if not, like we have the Data Spaces Support Center that is studying the needs of this community and also trying to develop some solutions for them. So they are developing like a blueprint and some guidelines for data spaces in a general scope. So I would suggest you to go through it and get a better understanding. Okay, having said this, like just to complete on these more general questions, we can start maybe with some questions that were for Jerome. So Jerome, the first question we had was from Virginia, and it was more on the clear definition of health data. What do you consider actually health data, and how do you understand the scope of this definition?
So, in the legislations, we do have a definition of health data, but more importantly, we have an article that specifies what are the categories of data, so the data types that would fall under this legislation. And this is quite a broad list. I mean, as I
Mm-hmm.
mentioned, from electronic health records, uh, data impacting on health, like on the social side, environmental side, determinants of health, administrative data,
Of course.
genomic data, proteomics. So administrative data. So we really try to, as much as possible, identify what will be the data needed if you're a researcher, if you're a policymaker, that would be relevant to use directly or link across different sources so that you can answer the research questions you want to answer or the policy you want to study.
Yeah, I
So the best
agree.
would be just be to the
Mhm,
proposal, I would say, to see what is the
mhm,
list. There was also a question on who would this apply, as a data holder. So we try to include data holders that are operating in the health or care
mhm,
sector or performing research in that sector. So if you uh, fall within this category, this legislation would apply, including these obligations to make your data known and make it available if a permit is issued. So try to reply as quickly as I can. That's
yes,
where.
I see. No, I agree with you. Also, the profiling exercise to understand which can, for whom this data can be useful is very important. Also, because for some sectors of the society, some aspects of health data might not be very important, but for others will be. So I
Mhm.
would say that it's sometimes a challenging exercise. We also face ourselves on that data.europa, understanding for whom is useful actually is data sets.
So for
Um,
users, in terms of data users, so we did not specify who could be a user. So what is looked at is first you can make a data access application that is then analyzed by the health data access body or health data access bodies, and they will look at what are you proposing to research, your credentials, the data that you're
mhm,
requesting, the data minimization aspects. Obviously, we're making sure that you only request data that you need for your question. So all of those are items what is identified, not really the who you are and where you're from. So we try to be as broad as possible.
Yes, yes, I understand. Also from, because now we were talking about data reuse, but what about data providers? We had one question from Beatriz on the access to stakeholders to this health data space. As data provider, how can you belong to this community? Do you have to be private, public bodies? Is there some sort of, is it obligatory or is it on voluntary basis? How do you work with your community of data providers?
So for data providers or data holders, they will be the obligation to make
Mm-hmm.
the data available on request. Now, we are not foreseeing any kind of centralization of data. So the data remains what it is. It is
Mm-hmm.
only made available in a secure processing environment for a specific purpose to specific users for a set duration. After this, the secure processing environment is deleted. So there are no centralization of data foreseen, for
I see. Okay. Yes, I see. I see. So basically, it keeps is kept on the data provider site portal originally, no?
Indeed. So the only
Okay.
part is the first step is of creating the datasets catalog. So national catalogs just to make the data known so that any user can understand what have been made available. And here we're just talking metadata. So just
I
information on
see.
the dataset, no personal data. That is what needs to be provided. Will be available publicly. Once the access application is made, so this is where access to individual data can be made available under the specific conditions I mentioned before in my presentation.
I see. I see. And then I understand that this community agrees between them on the governance actually and the.
So on the governance, yes. So we have a full section that describes. So
Mm-hmm.
one, the governance is entirely the member states' responsibility. So they will be appointed those have the access body that I mentioned before. So these are the stakeholders that also not only decide on applications but also define the rules for developing and expanding the infrastructure for secondary use. And the same
Mm-hmm.
happens with primary use. So those entities that are currently involved in my health ITU as part of the health network are the ones that are also deciding on the operation and the evolution of the primary use infrastructure. So it's member state led, commissions there to support.
Yes, yes. We also saw like this mapping of stakeholders that is like come from supranational, national, regional, and even local sometimes. So, which makes it very useful. What about you, Katerina? On the cultural heritage data space, how to belong to these network members? Because it's one of the slides you were explaining that that it's like a completely different community. How do you organize yourself in this network?
Yes. So the network is supported by the consortium that so by European Foundation, um, and it's really the European Network Association, which is the network of individuals, professionals in various sectors, cultural heritage professionals, digital professionals, professionals in the other sectors interested in reuse.
Mm-hmm.
They have um, I mean, the network is quite well organized. There is a members' council. They elect representatives. They work in task forces on specific aspects. That they have an annual program where they specify the work that we'll be doing. They contribute with the work from that community to the developments, the various developments in the data space. And then there's the network of the 40 accredited aggregators. This is the European Aggregators Forum, which also meets regularly. They have their own annual program, and they focus on of areas of interest for the sharing of data and improving data. So yes, so these are the two bodies, let's say, for the network. The European Network Association, to register to be part of this, there's a link on Europeana Pro. Anyone interested in any way or the other can join, can apply, can register, and they can also choose which community they want to be involved in and be more actively involved if they want.
Okay, great. Thanks also for this information. We don't only have public sector here in the room, like sometimes we have also academia researchers who might be very much interested about this network. So I would invite you to go to the sources that Katerina was mentioning and deep dive into that. That would be. And just going into the data, Katerina,
Yes.
with all the data that you are having on cultural heritage, are you planning to have it as open data, or is it already in the process? Or what are your plans?
Yes. So thank you for this question because it's an opportunity to clarify. In the meantime, I've just posted the link to sign up to the
Ah, very useful.
European. Yeah. So yes, I would like to go back to the slide about the current licensing framework. So there's a distinction between the actual digital asset and the metadata that describes it. So the digital asset, it's the cultural heritage institution that makes it available, that assigns a right statement to it, and
Mm-hmm.
the right statements. It's also, of course, we've seen over the years that assigning the correct right statement, also they need support in choosing the correct right statement. So right statements range from completely openly licensed, like in the public domain, to the CC license, the Creative Commons licenses, allowing some reuse or reuse, allowing reuse under certain conditions. And there is also a set of right statements from the Right Statements Consortium, which um, which are suitable for rights protected content. So before submitting the data, the cultural heritage institutions have to provide this information for each record. So what is the right statement that corresponds to the digital asset? So ranging from fully open to rights protected. And then metadata at the moment was, in the public domain. So not in the public domain, actually, it was the CC, the Creative Commons Zero license, which is, waiving any copyright limitations or any. So the cultural heritage institutions are free to choose what metadata they want to make available under this license. So however, as we are working now on a new data governance mechanism, the community now is having discussions, among others, about how to, well, whether, for example, some metadata would need need to be rights protected, and therefore maybe the new framework has allows for that. For example, um, and then monetization at some point later, also of the content that is well under certain rights and can be monetized. However, in the philosophy of the Commission and of Europeana from the start was the support for open data. So the idea is that if something is in the public domain in its original, if the original asset is in the public domain, then the cultural heritage institution should provide the digitized form of it also openly available. So that's the concept behind it. But as I'm saying, the community now is working on this new data governance strategy and mechanism. Uh, but in general, the line is to promote open data where possible. Uh, yeah.
That's actually very good to hear because it somehow is demanded that that we are having to make data as open as possible, of course, and maintaining the GDPR anonymizing where
Yeah.
possible, and that's what we're doing with our stakeholders. What from your side, Jerome? What about this open data that might be spotted under the health data space?
I mean, so in terms of open data, we didn't identify specific ones, but we can see, for example, any kind of research linking health data with environmental data, for
Mm-hmm,
example, geospatial data, that could be quite relevant for some of the research questions that we often see in the SDS to be able to support. Um, we these are the ones I can on top of my head can think of, but most of the data categories that are mentioned are health data, so they are personal health related personal data really for the most of them, the ones that are
mm-hmm.
listed.
Good. And what about regarding the that interoperability? Because since there are different type of contributors to this data space, at least from data.europa.io, we work also with different stakeholders providing open data. But it's true that we have to work on interoperability, have common standards. How you're dealing with this? How do you work with your stakeholders on this? Do you face any challenge or?
So on interoperability, um, the legislation applies to data that's already collected in its existing format. So we didn't want to mandate in which format should
Okay.
this data be made available for, in particular, for all the secondary uses, for primary use, that is for healthcare. I mentioned the European Electronic Health Record Exchange format. So there's all of those different data categories that I mentioned. So the patient summary, the prescriptions, in the future, medical images and medical and associated, records of those analysis. These will be standardized. So this is the only parts for that for which we will specify on which format should this be available to healthcare providers, but also to other users, to individuals as well.
Mm-hmm,
Um, so we are really we don't want to put an excessive burden, quite frankly. So first, we're not mandating any collections. The legislation only applies to data that already exists.
mm-hmm,
That's the first part. I think it's important to clarify. So, and to be made available in the format that's already available, or if the user requesting a specific format and the data holder or the health data access body can provide it in that format, then this could be possible, but it's down to them to decide if they can do it. And obviously, there are some fees will be foreseen to pay for this work. The idea is that data holders do not have to incur own costs to comply with the legislation. So that was one of the key points of our key part of our what we're proposing.
I see. So, as I understand, is that data holders are the ones responsible of the data that they keep maintain available, and it's under their responsibility to work on interoperability. This is what I understood from this discussion.
It is
Um,
this is data that is typically collected for other
mhm.
purposes, most of the time for
Yes.
providing care or for research. So this will continue. What we try to make sure is that this data is then available for other purposes as well. So that's really our infrastructure institute for the secondary use at least.
Hmm. And then, and there was another question from the chat on who is the entity responsible of the data space? How is the governance behind? I'm not sure if you addressed this specifically on one of your slides, but could you elaborate on this?
No, also for the governance part, so we have, as I said, the member states, and in more specifically, those entities that are appointed as health data access bodies when it comes to secondary use, or that are national contact points in the health data ITU infrastructure, my health data user infrastructure for primary use. So these are the entities that would be the part of the governance or taking decisions on the infrastructure. When it comes to data permits, this is down to, that is, this access to the data on an individual level. So to answer specific such questions, that's down to those health data access body to take that decision.
Okay, I understand. And then I have a question for you both regarding cloud providers, because we understand the different stakeholders that we have here in this community. So could public cloud providers be used to provide data on data spaces?
So to our part, we do not specifically mention cloud providers. We only specify that the data, when made available, this should be done in a secure processing environment. So
Mm-hmm.
a safe space where access is limited to those people authorized to access this data, where the data cannot be extracted, where analysis tool all made available to support this work. So whether it is in the cloud or at the on a server, the facilities will not specify in that specific point.
Mm-hmm. I see. I see. From your side, Katerina?
Yes, I would say the same. And also regarding the governance, it is a similar model for the data space for cultural heritage. There's a We have an expert group with member states representatives.
Mm-hmm.
So representatives from competent authorities, usually ministers of culture in the different member states, uh, who together with the commission form the governance of the data space for cultural heritage.
Okay, I see. So I see. And then there's another question for you, Katerina. It's on semantics and how you deal with them. Do you have a common methodology? What kind of software or products would you recommend?
Well, it's true. Europeana has been working on semantics, and in fact, the Europeana data model is a semantic is a model that allows semantic interoperability and linked data. There has been work on linked data, but I think it's something that is now coming back in the context of the data space. And there is a task force specifically for that, looking at linked data based aggregation models. And in fact, there's also a good example from the Netherlands, which is also being explored, and other countries are using linked data, like France and other countries use linked data for connecting, and that could be a possibility for including more data in the data space. There is also now, I will post a link, also you can see more about the
Mm-hmm.
linked open data in the data space. But as I said, work will be taken up again now in the context of the data space. And I've also so there will be there is a Sparkle API that people can see the published linked open data sets and query and retrieve there. But as I said, I think it's now that this will be looked at again and updated. And I have also posted in the chat the link for the MOOC that I saw someone asked for. So that is there as well, and I will also be happy to include it in the slides that will be shared.
Okay. Perfect. Thanks a lot, Katerina. Um, There's also one question from Raul on data collection and data processing, and this question was for Jerome. It was on who is responsible for the data preparation. Is it the researcher, or are there resources, people in the data space to do that?
So this responsibility for the preparation being linkage with other sources or transforming data into a specific format is the responsibility of the habitat access body.
Mm-hmm.
Um, it doesn't prevent it to be done together with or by the data holder as well. So I think we're looking at the case by case on who is best placed to perform this work to answer, the request on the user to have the data in a specific format or link to other sources. But any kind of linkage will be done, for example, only by the habitat access body, and they will be the one performing as well the anonymizations and the pseudonymizations when this linkage is done. So they will be the one holding the keys, let's just say, in the instances of pseudonymized data to ensure that users only have access to de-identified data.
Yes, I see. I see. And how is for you, Katerina, in practice? Who
In
is
practice,
responsible? Mm-hmm.
yes. So, in fact, well, the cultural heritage institutions are preparing the data.
Mm-hmm.
However, they are strongly supported by one of the aggregators, one of those 40 data partners that are either a national aggregator or a domain aggregator. So when a cultural heritage institution expresses interest to share data, then the most appropriate aggregator is assigned to help them prepare the data. There's also a sandbox that is made available so they can test whether the data set complies fully with the requirements and what are any problems, so they can correct the problems in advance before sending the data set for the final ingestion.
Okay, I see. There was also more questions. So one question, like from Raul, was data spaces once in operation have, of course, costs. Are they solely funded by EU funds, or what is the process?
So in our case, we are foreseeing fees as well. So data users would pay to have data access bodies and data holders for
Mm-hmm.
preparing the data and making it available in a secure processing environment. So this will be an additional source of funding.
Mm-hmm.
The um, development and the operation of those health data access bodies, the cost will be covered by member state as well, partially supported by those fees. That's what we're foreseeing those, but we certainly foresee some of the cost to be on the member state side and on the commission side as well for what identified as the central services. So these Europeans or these federated catalog of national catalogs of datasets, for example, or other services to enable the communications between the nodes. So this will be incurred by the Commission.
Yes, of course. We also understand, like from the discussion we're having here in this hour and a half, is that it's a process in the making. So there are some decisions also to be taken, and we have to see also what's the process, how the stakeholders react, what are the benefits out of it, and according to that, I guess that there will be, uh, like a follow up, because right now it seems like a bit of an innovative aspect where we are discussing now, and so let's see what the future brings. Um, from your side, Katerina, like how would you envisage this for the cultural heritage data space?
I think I missed the question.
Yes, so
So
so we were talking about data spaces that one in operation they have their costs of
yes,
maintenance, no?
yes.
So how do you see this in the future? Will be the only funded by EU funds, or how do you see this in the future?
Yes. Well, I mean, that is a very good question indeed. Because, yes, the experience has shown that like co-funding from cultural heritage institutions in the case of it was not obviously possible. Then member states reaction was that they contribute in kind. So the work they're doing in order to prepare the data to be shared, the cultural heritage institution and other bodies who prepare the data. So it's in a way contribution in kind. So, however, there's new in the digital decade policy program. There's this new concept of European Digital Infrastructure Consortia, the EDICS, where the idea is for member states to pool resources, to join forces, pool resources, and work towards a multi-country project. And there are the Commission launches calls for the member states to express interest. And I know, for example, for the language data space, there was interest from the member states to form an EDIC and contribute and, jointly uh, pool resources for the funding of the language data space. We don't have that yet in the cultural
Mm-hmm.
heritage. There were other, I think, discussions about having like a broader data space related such initiative. I'm not very well updated, but that could be, let's say, a possibility, perhaps.
Yes, yes.
But
As
it does depend on member states on
of course, and it's something that
interest. Yeah.
yes, something to be defined in the future. Okay, Katerina and Jerome, thank you so much for your interventions, also for taking these interesting questions that were shedding light on these data spaces, and also like bring some questions at the same time. So I will invite all our audience to go into the topic and read about it, because it's a very interesting subject and very important for the future of the data economy. Thanks a lot, Jerome and Katerina, again for your time. So just to like to wrap up, because it's time to finish the session. So you can provide feedback. You will also receive it afterwards via the feedback form. Since there were so many questions to be addressed, we collected all of them, and we will try to have a summarized report with the questions. So do like we will share with you after, also with the recording and with the slides. But there's more coming up on the Data Europa Academy activities. So we will have different webinars. So after this webinar, we'll have another third webinar that will be on discovering the building blocks behind the data spaces. We were here like zooming into the sectorial data spaces more in detail, and the benefits out of the health and cultural heritage. But here we will zoom out and have a step back to understand the technical aspects behind the legislative aspects, to ensure interoperability and to build up these data spaces. Also, on the part of the Open Data Maturity Report, as I was mentioning before, this assessment for countries on how they're advancing on these on data policies, we will have one webinar on the policy dimension with countries participating, explaining the best practices, and also another one on the impact dimension. Having said this, we also have the feedback on data.europa.eu and how to improve our services. You can also participate. We welcome feedback, as you can see, is something we always asking to our users. And you can follow us on social media in case of more information. Okay. So thank you very much. Have a nice rest of the day. Here in Luxembourg is sunny. So have a nice rest of the day and weekend. Thanks a lot, Katerina and Jerome, again for your
Thank you.
time.